Thank you. It's officially 6:02, so we're 2 minutes behind, and Mr. Allen reminded that we need to be 6 o'clock, so apologize. But thank you everyone for coming this evening, and welcome to Robert Wood Johnson University Hospital public annual meeting. My name is Jack Morris. I'm chairman of the board of Robert Wood Johnson University Hospital. And I want to also big shout out. I see a lot of people here, and I'm colorblind, but they look blue to me. The blue outfits. I want a big shout out to all our healthcare workers. You work tirelessly, and I just want to personally acknowledge you and thank you for everything that you do day in and day out, and everybody that works in this building from the basement all the way to the top floor. Again, thank you. The New Jersey Department of Health requires all New Jersey hospitals to host public meetings like this one to increase transparency amongst all New Jersey hospitals. Today you will learn more about our academic medical center, broad range of programs and specific services, as well as our plans for our future. You'll also have a chance to ask questions about the information presented at the conclusion of tonight's program. This year, we're also excited to provide you with an update of many facility expansions and enhancement projects that are underway and have recently been completed on our campus. We are confident that these projects will help us expand our capabilities, our reputation, and a destination for the most advanced world-class academic medicine in our state, in our region. The historic projects include one that I have close personal connection to, the Jack and Cheryl Morris Cancer Center, the state-of-the-art ambulatory medical pavilion, our surgical service expansion, and our children's same-day service unit at the Bristol-Myers Squibb Children's Hospital, amongst many others. Thank you again for taking the time out of your busy schedule to join us and learn more about our academic medical center. Now I would like to turn the program over to our Chief Executive Officer, Bill Arnold, to share exciting news about our clinical leadership and provide you an update about several ongoing building projects on our campus. Bill, please come on.
Thank you, Mr. Chair. So I'm truly honored to be here. I want to thank the board and all the community members, our employees, our front line. As Mr. Chair just mentioned, it's great that you're all here to support, and we look forward to hearing from you with some questions as well. So there's more to come on that, I'm sure. Can I get the next slide? Do I? Okay. There we go. So one of the things that I really take pride in here at Robert Wood is the relationship with the medical school. It starts with the board, then you have the relationship with the medical school, your front line, your staff, your medical staff, and you really have something special. Here, as we've continued to grow, and we've built these facilities, which I'll show you in a few minutes, we've also been able to recruit world-class physician leadership. And I'll say the flywheel is in motion. We're really gaining momentum, and some great leaders have joined us. So Dr. Jean Clark, who is our new chair of the Department of Medicine, joins us from Hopkins. So think about that. Just a couple of years ago, she could have stayed and been promoted there. She chose to come here based on her process, her interview, and our dean, Dean Amy Murtha, who also joined us, and I introduced her just 2 years ago. Next slide. Is that correct? All right, I'll go here if it works. All right, so next, Dr. Donna Darkar. So he's joined us from St. Louis Children's, and we have another superstar there running our pediatrics and the Bristol-Myers Squibb. He's our physician-in-chief. That was a long search, but again, we got a world-class leader, and we're all excited. Next one, and this is one Alan can speak to, so you may want to do this during your part, Alan. Dr. Stilianos, who comes to us from Columbia. He's a world-renowned surgeon, and he chose to come back to New Jersey. He trained here, or went to medical school here, and decided this was the place to come with everything going on. So again, great leadership. You deserve a round of applause, Amy. Martha. What's that? I'll do it. All right, so yesterday happened to be career day. So I know this is an old slide. You all saw this last year. But this school, which some had concerns with, including us, it's not easy. We're not in the business of building schools, but we partnered with DevCo and the town of New Brunswick, the city of New Brunswick, and this is what we built. Yesterday, I was asked to go on a tour by the superintendent and the principal. Kevin McTurnan, our VP of Government Relations, joined me, and it truly was amazing. We spent time in the labs, we spent time in the library, the athletic areas. Every one of these classrooms has a bathroom. So you think about kindergarten, first grade, second grade, those years where students may have to run to a bathroom. They have it right in their classroom. It truly, I've never seen anything like it. The principal, Ellen Treadway, she joins us for the city from Livingston. So she was in a really unbelievable rated school system. She came here because of this school and the students in this community. So it truly was a special day. And what was really nice, and I think Dr. Reinhardt would like this, because it was career day, the students dressed up in what they wanted to be, and there was a lot of nursing hats. A lot of nursing hats. So we also saw doctors, we saw biomed technician, we saw lab techs, radiology techs, a couple firemen, a couple policemen, and it truly was an unbelievable day. When you go into their gymnasium or you go into their lunchroom, it's second to none. The lunchroom serves to every student every day, breakfast and lunch. So those kids do not end up hungry. They can focus throughout the day. And the staff, which was really cool, there was a retired teacher that had worked here in the Cancer Institute, who is now retired but back doing substitute teaching. And she was so eloquent in the way she spoke about her time as a teacher, but also her time here in the Cancer Institute. So it truly was an amazing day, and that's something I'm probably most proud of, because those kids are being educated and they're looking to work here in many cases, so really cool. Okay, so we talked about new facilities. What health system, or hospital I should say, in the country do you know that does all of this in one shot? And that's where I have to give Alan Lee and his local team here a lot of credit. What they've accomplished, along with DevCo in many cases, or third-party developers, is simply impossible. It's too many things going on at one time, but they made it happen. That 15-story ambulatory medical pavilion just opened, so we're seeing patients. It's just been about 2 weeks. All we get is positive feedback. As you know, we're usually at capacity here, so we had the opportunity not only to build state-of-the-art destination sites, but we also have expandability and capacity build over time. So we have four floors in there. They're waiting for that next state-of-the-art destination program that our state needs. So it's really an exciting time. And the other nice thing about this was where Rutgers and Robert Wood came together through the medical school and worked as partners. We see it every day. It's a little tough. You're building together. You're trying to grab additional resource, additional space. We all came to an agreement on how to best build this, how to best staff it, how to best set up the facilities, and it's simply amazing for our patients. Next thing is the private rooms in the pre-post-op. This is another one. You never have post-op rooms that PACU, I'll call it, where the patients would like to stay rather than go to their room. They're usually racing to get away from those screens, that they have between two patients, and patients are tight, families are on top of each other. Sometimes it's hard to maintain confidentiality. Well, Robert Wood has a private room that really looks close to an ICU room. So those patients, if they have to stay, it's not an issue. So when we are at capacity, that's a place they can slow down before going to their next location. I can tell you, we get so much positive out of this. Our physicians love it, as do Then the Children's Hospital. So they dedicated the Children's Infusion Center. If you think about that, there's so many times a patient needs infusion, but it's not necessarily chemo. So to bring a child in and not mix them into the cancer program is so good, and it just takes that fear away. It's something we were talking about earlier, Susan. It's just great to give them that best environment. Next slide. Okay, I'm not going to maybe.
We like to think of ourselves being a major academic. We like to think of ourselves. If you go into the operating room every day, there are miracles. If you go into the operating room every day, there are miracles. By everybody under the radar. Everybody's modest. Everybody's under the radar. Everybody's modest. They do a great job. Surgeons, the nurses, the techs, the staff, everyone.
The construction team here at Robert Wood, they built an amazing place that will change healthcare for New Jersey.
This building becomes the
We spent too much money on buildings. We have to get
We like to think of ourselves being a major academic medical center. And if you go into the operating room every day, there are miracles being performed back here. You wouldn't know it. Despite everybody's under the radar, everybody's modest, they do a great job. Surgeons, the nurses, the techs, the staff, everyone.
The construction team here at Robert Wood, they built an amazing place that will change healthcare for New Jersey.
this building becomes the destination.
All right, so let's pivot to the rest so that we don't have to put everyone through what we have. Okay, so what you would have seen in the rest of that video is the opening of the Jack and Cheryl Morris Cancer Hospital, or Cancer Center. And as our chairman, Jack Morris, mentioned, that's near and dear to his heart. He, as well as Dr. Steve Labuti, who was here earlier, that's their vision that was set before Dr. Labuti joined the health system. So with Dr. Labuti's vision and passion aligned with Jack Morris's, they built something that's truly second to none. The state's only freestanding hospital, which will be seeing patients officially on June 23rd from an outpatient standpoint. And then early September we'll start the inpatient operation, which will truly give not only this local community the opportunity to be cared for, but the entire region, meaning Philly, New York, and New Jersey. It definitely will be a destination center for our health system. We've built really an outpatient model that feeds in. We have a facility being built, large facility in Monmouth County. We have a large facility on the campus of St. Barnabas Medical Center in Livingston, Cooperman, Barnabas, and all of that feeds into this highest level of care around oncology. So, it really, it's one of the things that I'm most proud of, and it's really due to the relationship that Jack built through the interview process to bring Dr. Steve Labuti in, and then really funded so much of it. So Jack, thank you. You deserve a round of applause. And then, I think lastly, but most importantly, I mentioned the work we're doing with the medical school and how important that connection is to truly develop this place into a premier academic medical center, but also to create an academic health system, tying in all those pieces I just mentioned around oncology, but around all the service lines. The fact that the medical school, through Rutgers, along with some other partners, including some competitors, Hackensack, they all leaned into this under DevCo's leadership. And now they're in the process of building the new medical school and research facility, which will open about this time next year. Not to put pressure on Rutgers and DevCo, because it's always hard to pick the exact date when you're building something that significant. But that really changes New Brunswick. The partnership we have with Rutgers, the facilities here, the connection to Rutgers, the connection to the county, by the way, that's something else I should mention before I turn it over to Alan. They've leaned into the strategy and they've invested in the strategy. So when we look at hospitals, we shouldn't just look at them as places to go for care. We should look at them as places to educate our children and our community as we go forward. So as those kids in first, second grade were wearing their nursing outfits yesterday, that's the start to connect them in, and that's why the county, along with our health system, have invested so much outside of the four walls of the hospital into the community, and as well as into the educational system. There's a win-win there, and that's why we're together on that. So without any further ado, I will pass this over to Alan, and then after his presentation, there's one more. I'd be glad to come up and answer more questions. Alan?
Thank you, and good evening again to all of you. Thank you so much for joining us for this annual public meeting. As you've heard from our chairman, as you've heard from our CEO, we're really excited about so much of what's going on here, and we'll take a moment to share a bit more with you about that, perhaps. Anybody with a song and dance while we do that?
What's the other one? Yeah.
So we'd like to begin just with some of the language that we've developed for the health system under the leadership of Mark Manigan as he assumed the role of Chief Executive Officer and President for the health system, beginning with our reason for existence. It's our mission. We are an academic health system partnering with our communities to build and sustain a healthier New Jersey. That is the fundamental reason of why we exist. But when we then look at our vision, RWJ Barnabas Health will be the premier healthcare destination, providing a patient-centered, high-quality academic medicine in a compassionate and equitable manner while delivering a best-in-class work experience to every member of the team. That is the aspiration, and what's powerful about that statement, it's both about providing world-class care, but also creating a world-class environment for our team members to both deliver the care in as well as support that care delivery. And then there are our 8 values that we've developed for the health system. They are in alphabetical order. It's accountability, compassion, curiosity, empathy, excellence, kindness, respect, and teamwork. We try to make sure that as we're selecting new talent to join the organization, as well as any time that we are managing our own comportment and behavior, it's around those values. When you think about where we are in the state of New Jersey, and we are of course currently centrally located, I'm going to speak a bit more about our health care system and its impact across this state and the region. We are 12 acute care hospitals. We are 3 acute care pediatric settings. We have 2 adult trauma centers in the health system, and we have 2 accountable care organizations. There's 1 freestanding behavioral health hospital, and we have children specialized right here on this campus. Among our 3 acute children's hospitals with 1 pediatric trauma center, guess where that pediatric trauma center is? It's right here in New Brunswick. A little bit further in terms of some of the statistics, we have about 43,000 in workforce for RWJ Barnabas Health. We have more than 9,000 physicians and greater than 1,600 medical residents. And so as you think about the state, there are hundreds of primary care and specialty care physician practices across the state. We have retail pharmacy services, comprehensive home care and hospice programs, fitness and wellness centers that hopefully you are also aware of. And the list really goes on and on. We are nationally renowned, and we take great pride. You've heard this from Bill, and you've also heard it from others, that we are gaining a real national reputation with the work that's going on here. New Jersey's only NCI-designated comprehensive cancer center, the largest adult and pediatric cardiac surgery program in the state, delivering the most babies in the state of New Jersey at 9 maternity hospitals. It's the only lung transplant program in the state as well. We have the state's largest unified EMS provider and one of the top 10 heart transplant programs in the nation, with locations in Newark as well as here in New Brunswick. It's the largest and most comprehensive pediatric healthcare program and provider in New Jersey, 6th largest kidney transplant program in the United States, and the largest in the Northeast. It's New Jersey's only certified burn center, New Jersey's first and only freestanding cancer hospital in New Brunswick. It's top 1% of all Epic customers in the world. And it's the largest simultaneous kidney pancreas transplant program here in the state, and most comprehensive mental health services in our state as well. So a bit more about our commitment to social impact. And this is something that is near and dear to the heart of our Chief Executive Officer for the health system. It's near and dear to the heart of the Chairman of our board, and certainly to our CEO. Around that, and these are just some of the statistics, greater than 220,000 pounds of food has been distributed. 8,476 households have been served. Greater than 215,000 diapers distributed in this community, and more than 30,000, closer to 31,000 meals served. We've connected with more than 60,000 patients and counting more through the Community Health Worker Program. So many of the members are right here in this room, addressing food insecurity through community gardens, greenhouses, and food franchises, food pharmacies, forgive me. So a bit about the vital statistics here in New Brunswick. We are currently licensed with 628 beds. That number will increase by greater than 90 beds when we open the Morris Cancer Center in the phase 2. We have 2,245 on our medical staff, 350 medical residents, 2,117 nurses who practice here, 5,603 team members, and that's inclusive of all with the exception of our physicians. 36,595 inpatient admissions per year. Last year, we saw 331,093 outpatient visits, 104,509 emergency department visits, and 2,667 births. One of the things that we are incredibly proud about as we serve the community, and it's certainly one of the jewels in our crown, which is the Bristol-Myers Squibb Children's Hospital. It is the hub of New Jersey's only pediatric academic medical campus. We have there a 105-bed dedicated facility for children's care. It's the only facility with dedicated 14-bed adolescent unit, which we're also incredibly grateful for. It's a level 2 pediatric trauma center, a pediatric emergency department, 6 pediatric operating rooms, an ECMO center, one of only 2 in the state, and New Jersey's largest child life program. And I will tell you, if you know nothing else, I've often heard people, when they try to define what child life is, and they'll say things like, well, they're the ones that will bring coloring books or Play-Doh to just help distract the patients. It is far beyond that. Our program is not only the largest in the nation, but the leader of our program is highly sought after nationally to really think about how do you care for children and help them through moments such as those that have anxiety about testing, or those that may have anxiety about getting an MRI done, and how do we keep them still enough for the period of time to get a good study. The list goes on and on and on, but it also means that on the adult side, sometimes young adults who are parents of young children, unfortunately, have challenging situations, and we have to care for the children in those settings as well, and the list goes just on and on in terms of their value and what they do. Bill spoke about this slide incredibly well, and I want to just highlight it was on his arrival here as the Chief Executive Officer that he made an absolute commitment to forging a new relationship with the medical school in particular. And he said, our doors will be open to receive our faculty, to make sure that they are represented at every key meeting that we do and that we have, so that we understand what's important. And he knew that for us to forge a journey as an academic medical center, continuing toward an academic health system, that we have to figure out what does that partnership look like and how do we optimize it. It fully became optimized when the dean of the medical school arrived and the partnership flourished from there. And so there's so much more to be done, but I will tell you, it's an extraordinary partnership. We are the flagship location of the Rutgers Cancer Institute, which you've heard so much about. Our collaborations with Rutgers Health, Engineering, and Business Schools has been really profound. And the founding partner in Rutgers Helix Building for biomedical research. I will not go through all of these banners and awards because that would be incredibly self-serving, but we are proud of so many of the designations and distinctions that we're becoming known for, particularly around clinical excellence. And in particular, we appreciate with U.S. News and World Report, you'll see that 2 of our gold banners, which means that we have among the very best programs in the nation in pediatric orthopedics, pediatric urology. That is really something that we're very proud of. And I'll then go to the very middle of that page, you'll see our magnet recognition. We are one of only 7 institutions in the nation that have been redesignated 6 times for magnet recognition. This is extraordinary about creating an incredible culture of nursing excellence and the ability to both attract and retain the best in nursing. So it's not only great for our nurses, it's great for the entire institution. And for the state of New Jersey, I mentioned that there are only 7 institutions with that. 2 of those institutions are right here in this state, and we are one of those 2. You can imagine who the other is. Do I have to state it? One of the other things that we want to talk about just briefly is serving New Jersey. When you think about, we are a destination for patients from all 21 counties in the state. Bill often, when he and I are in meeting in his office, and his window gives very direct oversight for when the helicopters, multiple times every single day, are landing. And it's really remarkable to watch, and we always know what's going on in those moments. But we are one of 3 state-designated Level 1 trauma centers in New Jersey. We are the first designated pediatric trauma center, currently with a designation of a Level 2. And we are a leader in statewide emergency preparedness. We have been able to demonstrate that, obviously, with Ebola, as well as with the COVID-19 response, and so many other times. And we are fortunate that our organization is a place that the state offices will reach out to say, help us to think about how we are coordinating and advancing care in these emergency situations. Centers of Excellence, service lines. These are our service lines that have demonstrated incredible strength and excellence, including cardiovascular care, cancer care, pediatric health, neurosciences, women's health, GI and GI surgery, bariatric surgery, trauma, heart, kidney, and pancreas transplant, and also our care for the LGBTQ plus health services and the community's needs. It's something that has really expanded across programs here in our health system. I'm going to spend just a brief moment talking about some of our growth. And we'll date ourselves back to 2020, which was, of course, the year of the beginning of the pandemic. But if you'll look in the blue, which indicates our adult inpatient admissions, back in 2020, we were at 22,000 plus admissions. Fast forward that to 2024, where we had nearly 30,000 admissions for adults. From a pediatric setting, which is in the red in 2020, we had 2,853, and the growth year over year over year over year, getting to 2024 to 4,766 inpatient admissions. The only place where we saw some diminishment from 2020 versus 2024 really is our newborn population. In that year, we had 2,582, and that became 2,197 newborns in 2024. Emergency department visits, similar growth patterns as you'll see. I won't go through all of the numbers, but very significant growth from 2020 to 2024 for our adults, which is highlighted here in blue, as well as our pediatric population in the red. Improved mortality and patient experience. This is a slide that we've put in to talk about how we focus on opportunities within our organization. And so you'll see on the slide to the right, we started our improvement back in 2023, the fourth quarter of that year, where we saw, in full candor, our worst performance with regard to patient experience. And this is one of only of several domains that have shown extraordinary improvement with a very, very methodical approach to that. And so you'll fast forward that all the way over to the right. In the Q2 that we're in now for 2025, it is at the 55th percentile. In other words, we're outperforming 55% of the hospitals in this database, which is the largest database in healthcare through Press Ganey. To the right of that is our improvement with mortality. The goal is that we have our mortality both observed and expected, and if we do not expect that a patient should pass away, we have to make sure that we're doing everything to provide incredibly safe care. And so you'll see some incredible improvement in this year over year as we get to our current performance. Our Chief Medical Officer, Chris Gilligan, who is here, who is incredibly proud of the team that have been able to deliver this, and it's very multimodal, multidisciplinary in terms of how you achieve this. But he and our Chief Nursing Officer, Maureen Harding, would both agree we are not stopping here. The goal is generally zero. So we're incredibly proud of that work. RWJUH Foundation and its impact. We have raised, I'm going to go to the slide a bit, $11.1 million in funds for this place. Distributed $16.6 million to directly support the hospital capital and programmatic needs. And so that's been really terrific because our teamwork, our team rather, gets to see how those funds are used in real time. We've celebrated the transformative investments in areas such as our pre- and post-operative services, our pediatric bone marrow transplant and cellular therapy program, our oncology services at the Jack and Cheryl Morris Cancer Center. We've provided funding to nearly 100 nurses and CCTs for continued education opportunities with both conferences and scholarships. And we have raised over $100,000 for our Employee Assistance Fund, supporting over 100 of our RWJUH family members with meals or finance assistance. When Bill Arnold got here a number of years ago, one of the things that he had us all really focus on is let's get to know our workforce and let's make sure that we know their needs. One of the darker moments that we discovered in those early years was that sometimes we have workforce that are living in a way that is not full. We found out that we had workforce sometimes that fall on hard times due to fires or other reasons and are living out of their cars. Workforce that struggle with meal insecurity. Bill and the rest of our team said, we cannot be an organization that turns a blind eye to that. We've reached out to our board, we've reached out to our workforce to say, let us think about who we are and be our brothers and sisters keepers and think about how we ensure that we're taking care of each other when we fall on hard times. This last one that's listed here has been incredibly meaningful and one that we're very, very proud of. And so as we wrap up and get ready to turn over to my dear colleague, Maria Merced, who has just done phenomenal work in terms of our outreach to the communities, and it's where we believe that the real work truly is done. It's in keeping with our mission. I'll just close by saying it's such an honor for us to present a bit of our story to this really wonderful audience, and to let you know that, as I said, that Chris would say to us often, and Maureen says to us often, we're not stopping here. The goal is truly to deliver on excellence as we commit to this population, and to also make sure that we continue on a journey to national and international excellence. Maria Merced.
It's always such a pleasure to present at the public meeting and talk about the many initiatives that we have in these communities. And before I start, I want to recognize some of the people that are here today that are from our Community Relations Committee. I see Jose, our chair, and I see Karen Perry from the East Brunswick Library. The Morgans are here from the NAACP. Thank you so much for your support. And I also want to recognize the head counsel of our new Mexican consulate that is here with us, Mariana Diaz, and the community council, Irma Hilarios. Thank you so much for being with us here tonight. And I can't miss recognizing our community health ambassadors that are here with us. These are your boots on the ground. These are the people connecting people to services here in the community. And also Sarah Jane is there in the back that has that new group of community health workers in the emergency room, and we have been able to connect them both to do amazing work in this community. Thank you for your support. You know, the goal of our program is to provide access to preventive primary care, health information, health literacy to communities that we serve in Middlesex County, and we have a special emphasis on the identifying medically underserved communities to community outreach, and also the creation of many community partnerships over the years. Every 3 years, hospitals need to put together a community health improvement plan that eventually becomes a community. First we do a community health needs assessment that eventually gets to be a community health improvement plan. And throughout the years to do this work, we created Healthier Middlesex, a consortium of community-based and health organizations that help us put the plan together. We do this in partnership with St. Peter's University Hospital. We look at secondary data, community surveys, focus group, and we develop goals and objectives based on priority areas. And we're actually doing this work right now on Friday. Is our big meeting that we're putting all the information together. So our current SHIP, the Community Health Improvement Plan, all our work is embedded within that plan. Our priorities in the current one, which is 2023 to 2025, is mental health, access to care, food insecurity, housing, and financial insecurity. I'm sorry about the busy slide, but I wanted to give you some highlights of what we have found last year in the community survey, what people have said, their concerns. So the top 6 are heart disease, cancer, diabetes, mental health issues around depression, anxiety, suicide, obesity, overweight, and housing that people can afford. Issues that made it hard for people to access care in the last 2 years. The top one was hard to schedule an appointment at a convenient time, wait times at doctor's office or clinics that are too long, doctors not accepting new patients, insurance issues, and cost of care are some of the issues that we're going to be working in that community health improvement plan. So going back to the work that we're doing here in the community, our health education programs, as you know, we partner with many community-based organizations, our places of worship to do meditation and relaxation, adult health education, mainly done with our faculty here. I want to thank Dr. Karen Lynn for always being there for us and providing a lot of the residents that do this work. We host nutrition classes, fitness and wellness programs, a number of special events throughout the community in the different topics. And last year we began a program with our nursing department where they come and they instruct our community health workers that are bilingual to do ESL, where they can refine their language skills, but also learn a lot of the medical terms. And we are also doing a lot of ESL classes with our employees, and you see we have a lot of response for these classes. In our health promotion programs, we have the largest and the only diabetes support group in Spanish in this county, where we have 60 members, 44 newly diagnosed from last year. They have a support group, and they also have different educational and goals that they have to accomplish to better manage their diabetes. We have a Project Inspire, which is a program for the sons and daughters and grandkids of those diabetics, so they can learn how to have better nutrition. It's an active kind of camp. It's a boot camp where they go into the fitness center or one of the schools and do fitness programs, and also cooking demos that they can then take back home and teach their parents how to cook a little healthier. We have a number of support groups that are very well attended from what you can see. Also during the summer, we host a number of summer programs. This has always been our signature program. It's on its 29th year, where we use art as a way of students expressing themselves, of issues happening at home, happening in their neighborhood, happening in their community. I have to say that, we went through the pandemic, and we came out of the pandemic. It was very hard for the students to engage. It was very hard for them to relate to each other, nevertheless to relate to us. I must say that last year, we saw a light at the end of the tunnel. We see them more engaged. We saw them relating to each other and engaging in things that they are usually not used to. Then we have our Community Health Ambassadors training program, outreach and research. They're working with many of our faculty, engaging minority communities in research. They had a lot of touch points last year. They're doing that door-to-door canvassing, visiting our restaurant, visiting our different neighborhood organizations, talking to people and engaging them in the different health screenings and programs that we have. Last year, we had the opportunity to hold a mental health conference in the community, all in Spanish, with NAMI en Español. Very well received, 200 participants. We have spent the whole day talking about different health topics related to mental health, depression, anxiety. We have physicians and counselors there that could talk to the parents about skills to promote, better mental health in the community. And the crown of the jewel, like Mariana always say, this is the new partnership we began last year. It hasn't even been a year yet. As you can see from the numbers, last year we signed an MOU to offer health services, screenings, educational sessions for inside the Mexican consulate through their window of health, or La Ventanilla de Salud. This has been an amazing partnership. We have been able to identify many residents that for one reason or other or a barrier have fallen through the cracks, and they have the community health workers and Rosabel Pastrana that's here and Irma that are there weekly can identify them, can follow up. We partner with the community health workers that are in the emergency room, and they can connect with the services that we have here, and it has been an amazing partnership. In early detection, I want to highlight that we continue to work with our family planning clinic, doing all the outreach there. This is under the leadership of Dr. Glenn Marie Matthew, that is amazing in providing a number of services for the community. The program has expanded their hours. They are now doing telehealth with many of their patients. They're doing the birth control, the STI testing, the pap smears. They have bilingual staff, and they serve the uninsured patients. I think the most important part is always for me the education that they provide to the community. We're actually in 3 high schools providing reproductive health education, and it's been an amazing process. And as you can see, we have been able to increase the number of students that are participating in getting the services that the clinic can offer to them. Again, early detection, we are very active in doing a lot of community health fair, which is so important for vulnerable communities that they can find where they can access services in the community. We have a number of people that are coming new into the community and need those connections. Last year, also with our flu clinic, vaccinated 500 kids in the school system, 100 adults. Our COVID-19 and outreach vaccine that we did for 4 years, unfortunately, that was one of those grants that got eliminated. But we were able to do a lot of community education and really explain to people the importance of getting vaccinated. Our men's health fair continued to be very active. We're doing this with Health Equity. It's an amazing partnership that we have been doing with them. Thank you so much. David is back there. And we continue to hold annual screenings for breast and cervical cancer for our low-income women. I also want to highlight our hospital violence intervention program, and Elaine is one of the managers. She's here with us. This is access to care for people that have been victims of community violence. Last year we assisted 157 crime victims. We provide food, transportational, personal advocacy. We complete their BCCO forms for them, accompany them to the services. The majority, the victimization issues that we see, 41% is physical assault. We see stabbing, gunshot wounds, and domestic violence. Most of the patients that we're seeing in this program are Latinos, mostly male, and I'm happy to say that we have a community partner that is the Puerto Rican Action Board that works with us, that provides trauma-informed care, and 89% of the patients who accept mental health counseling experience a reduction on traumatic symptoms. And as we work with the patients, we have seen that 54% of the patients enrolled in the program accomplish a lot of those goals, that they want to continue to live a healthy life. In our community, in our domestic violence awareness program that we began in this hospital back in 2013, when we actually lost a community volunteer to an act of violence. We decided that, we could cry and we could do a lot of things, but we can also have some action, and we created the first domestic violence awareness coalition that does education, training, awareness in the community, and also we host an annual march, and you can see in the picture our Deputy Chief Bobadilla that help us every year put this march together. In the food insecurity space, a lot of those numbers that you saw before in that slide, you can see what we have given here in our maternal and food pantry. But I wanted to highlight the Linda Bright Smile food distribution program that we started back in the pandemic when we couldn't find food here, and corporate helped us, and Bruce and Debbie are here saying yes because they help us come and put those boxes together. We continue to distribute 270 boxes of fresh produce to our seniors, to our diabetics, to our needy families. Through that program, we gave over 4,000 pounds of food. We work with the Sudan Street Reformed Church. They have a food pantry. We have volunteers that go and plant their garden, and then all the produce that goes from that garden goes into the food pantry, so that people that go there have access to fresh produce. Our maternal wellness pantry, we have 66 moms that are either pregnant or postpartum, and that's a total of 457 family members. We do referrals for support and social services, and refer them to social services program, blood pressure screening and other screenings through the Rutgers School of Nursing. And I'm happy to report that this year we were able to get a SNAP navigator, in every hospital in the RWJ Violence system has a navigator, and Chelsea is right here. She's been working in the different pantries in the city, also in the different community-based organizations, and with our community health workers to complete the application. It's an application that sometimes can take an hour to complete, so it was very important that we could get the assistance of somebody that was trained by the state to do this kind of work. And also, to, people to certify the people, and also sometimes they get the card and they don't know how to use it. So she goes back and help them tell them how to use the card for their food stamps. So besides the food, we have given out over 26,000 hygiene pads, more than 52,000 diapers, and over 34,000 pounds of food in our food pantry here. So if you look at the other numbers, we're right there. Our healthcare hospitality training for youth, this is in that space to make sure that people from this community have access to employment here at the hospital. This is a partnership with the Youth Advocate Program, with DEPCO, with the Gingoli Construction Company, and Middlesex College. We have 25 students that come for 8 weeks here to the hospital. They get healthcare, employment skills, training, and rotation to a number of departments here in the hospital. They get a stipend and opportunities for mentorship and employment. The idea is that when they turn 18, they can apply for a position here at the hospital. One of the areas for our community health improvement plan was the use of technology to help residents access health care, and we're happy to partner with Dr. Sabina Hussein, and we have here Elvia, that is our outreach worker that works, and also we have, we said that are navigating people to this platform, and they receive texts to make sure that they're doing okay. What do they need? Do they need to connect with a physician? Do they need assistance with transportation? Last year, over 800 patients were enrolled. Also, we have a very active social media outreach through a Spanish-speaking Facebook page called Su Salud that we started over the pandemic to make sure that we were connecting with the patients here in the community. We do Facebook Live, we have 1,000 followers, and 66 hits last year. We also have had a connection with the East Brunswick Library for many, many years now. We have done a number of programs to promote health in the community, and we continue to provide health literacy videos together with them at the library. I wanna brag about the honors that we get. Last year, our Latino Diabetes Program got the Community Honoree at the Vision Gala of the Diabetes Foundation, and more recently, the School of Social Work, the Center for Research on Ending Violence, gave us the 2025 Community Champion Award for all the work around domestic violence here in the community. The staff, the employee, the board, the administration, because every time we put something out together to ask for some kind of drive, we get more than what we need. And for our back to school drive, our book donations, our turkey donation, the Adopt a Family program, the holiday party for the children here in the community, donations for hygiene kits, community service day, prom dresses, the MLK reading service. Always we get a lot of response from our employees and also from the staff. Thank you so much, and this concludes my report.
All right. So that concludes the presentation. So why don't, Alan, you want to join me? Sure. Let's go into questions, and hopefully we have the answers. Charlie.
Good evening, everyone. Charlie Cradaville, New Brunswick today. First question is an important one. I want to ask how Robert Wood is coping with the new federal landscape, potentially devastating cuts to the social safety net, what are you doing to either fill the void or fight back or defend healthcare?
Hey, Charlie, that's a great question. We were just discussing that at our quarterly board meeting just prior to this. It was a presentation that was given at the system board by our, oh my gosh, I'm drawing a blank, George Helmy, who's joined us as Executive VP of Government Relations. So he presented there. We then presented to our finance committee, because as we build our budgets, we have to be very careful. To your point, there's a lot of risk there, and every day the risk changes. Some days are terrible, some days are better. The worst case scenario, we could see tremendous cuts. And what we'll do is we'll have to curtail certain programs and within the health system. So we'll never leave our community short in terms of care we give, but we will have to address that, because it would bring us, worst case scenario, into a situation where we'd have to slow down. Now the good news is we've expanded in so many areas in terms of building. So things you'll see slowed with reimbursement change is capital projects. And our health system has got many of the priority ones, like the Jack and Cheryl Morris one, behind us. So that's good news. I worry about not only our hospital, the health system, and all the hospitals in the state of New Jersey. I just recently was chairman of the Hospital Association, so my term has ended, and that's all we discuss. So we have our association lobbying on behalf of us at the state level. We have the AHA lobbying for us at the federal level. And then, of course, as a health system, we're heavily engaged in the conversations. What we can do is help educate any of the lawmakers on what the consequences are. And those consequences are big. And we'll figure out more in July as we get into the summer months, and then again later in the year, and we'll develop our budgets around those changes. So we don't have a lot of facts yet, but we do understand all the different risk factors, and we've modeled them. So we understand worst case scenario and right down to not so bad scenario. And we're really believing that we're going down the road where it won't be so bad. So there's no reason to panic, because again, with the modeling, we're able to adjust the way we do things statewide. And by the way, that's something we partner very closely with all the CEOs and presidents within the state of New Jersey. And we lobby together with the association, as I mentioned. I don't know if it's hard to answer your question because every day changes. Sure. When you turn the news channel on, you see the changes each and every day. So to give exact answers right now is tough, but yeah, we're on it.
It's hard to keep up, but yeah, I definitely try to do my part to stay informed and keep people in New Brunswick informed. I know the cost of care is a concern that was addressed in the final presentation. What are the hospitals, what's your perspective on the insurance business and the push for universal health care? I think I asked about this a few years ago. Certainly want everybody to have coverage, everybody to be able to use health care. How does the hospital work with insurers, and would you like to see private insurance go away?
I would never like to see private insurance go away, and that's my perspective. Everyone has a perspective on this. I'd like to hear Alan. I'm sure you'll like to hear Alan's as well. I believe that when you have competition, both on the insurer side and the provider side, our side, it pushes us all to continue to raise the bar in how we service our communities. If you make it universal, all that pressure to compete is put on the sideline, and then maybe you're not battling. Like it's not bad to have a Morris Cancer Hospital built, and then somewhere in Morris County another oncology facility built. It keeps us all moving in the right direction to better serve the communities. We're forced to always stay on the cutting edge from a facility standpoint, from a technology standpoint, and from a specialty standpoint. So I believe all that competition, which some people look at as negative, I think that pushes us to do better and serve the communities better.
Maybe what I'd add to that, Charlie, is that there's a bit of a history with our health system in terms of its commitment to the communities that we serve. We are and have been the state's largest provider of care for underserved communities, and we're very proud of that. And it's something that we expect to continue. We think that we have a responsibility. Of course, you'd like to see, whether we talk about the cost of pharmaceutical medication or the cost of insurance, and the list goes on and on, the cost of devices in healthcare. We'd like to see all of those types of things continue to be regulated so that it makes a bit more sense. But I think we as an organization continue to be very, very committed.
That point you just made it so perfect. And the fact that we're the highest provider of Medicaid and charity care times 2.5, right? So we've evaluated this at the state association level. So it's very clear who's providing care to the most vulnerable, the point Alan just made. So, but that also puts you in a high-risk place, right? Because that's what, right now, the administration's after. They're after that Medicaid spend. And hey, I look at it as there may be some areas we can do better in how we manage those funds. So to your point, cost of care, we're working with third parties to look at everything we do to see how we can do it better when we compare ourselves to the best places in the nation. So at least we keep looking to be premier during these turbulent times.
Well, thank you both. A couple more questions and a comment. The parking situation. Last year it was discussed that both hospitals in New Brunswick both said at their annual meetings they want more parking. Can you share any specifics on what your plans are for that?
Sure, I will, but I'm also probably going to call on an expert in the room who's helped us to get to a significantly better place, which is our dear colleague Kevin McTiernan. Where I'll start is part of what has helped us with this is getting the new parking deck for the Morris Cancer Center, which affords a large increase of parking spaces for us. One of the things we've been committed to for our workforce, and we had to recently think about our priority, the reason we exist, is we care for patients. We need to ensure that our patients are the priority when it comes to parking, because we knew that we were seeing patients arrive late for appointments because they were circling garages looking for a parking spot. And so as a hospital, we recently sort of redeployed by seniority where our workforce are parking to ensure that we left enough spaces for all of our patients and their families when they're arriving. Thanks to so much work that Kevin has done, both with the city as well as with our local team, to help us to reimagine what a better parking situation looks like in New Brunswick. We are currently in a far improved space, and as much as we thought it would be incredibly upsetting to our workforce, they actually responded incredibly well, and we've gotten great feedback. Kevin, anything you'd like to add to that?
Well, first, just to echo your point about the work that you and your staff did to have employees in the correct place so that our patients could always be closest to the point of care. That was an amazing feat. I don't want to underestimate what you did. And I think at this time it would be safe to say that given all the activity downtown, the current parking situation, the situation that we expect to have on this campus as time goes forward, that both the authority, the hospital, the health system are going to look at the best way to resolve those. I don't think there's an answer yet, but it's certainly percolating in all those organizations.
Thanks for that answer. I just wanted to make some suggestions on the topic. I know that, to be able to grow in a way that's sustainable, we can't have everybody have a car. It's just not sustainable. And so fortunately, we live in a walkable community. I know the hospital already does some, shuttle operations to facilitate employees getting in and out. So I think operating more shuttles to help people get here, promoting and supporting existing transit services. We're blessed to be near a train station, and we could do better. The train service could be better, the buses could be better, and if leaders like the hospital system push to make it better, we can do it. I also think that it was mentioned in the final presentation, the cost of housing is actually like a health problem because people are not able to get affordable housing, and they're spending so much of their income and assets on that. I know there's a state program that the system's involved in Newark, I believe, to actually leverage the hospital to build housing in the surrounding area. And I would think that, you know, having workforce housing to make it easier for your employees to live within walking distance potentially of the hospital would be another thing to mitigate that parking demand. And so I just wanted to make that suggestion. And I think that the only other question I had was I just wanted to ask if you could, you know, if the board members who are here today could identify themselves, if I could just find out which board members are present today, and that's all.
We have this sign-in list that we'll show you on the way out.
Okay, I just don't know who's who, so I was
Yeah.
hoping that people could introduce themselves, or at least like a roll call or something.
Would you like to introduce yourself?
Elisa Sassi. Art Cifelli.
As soon as we started the questions, a few left. Jack Morris was here. Dr. Reinhardt just stepped out.
Yeah, Bill, there was a bunch of people who had signed in and stayed for the majority of the presentation.
Those points you just made regarding housing, that's something that we're, as you mentioned, we're working on in York. We're also working on some of those items in New Brunswick. So the elected officials here, led by our mayor, have been very good in terms of partnering with us, and we're looking to help in that, in some homeless programs and such. When it comes to the affordable housing, that's a great idea. We just discussed that the other day, so I have an answer. When the regulations around affordable housing do not allow us to pick who goes into it's a competitive process based on a bunch of criteria. So it's a hurdle we have to get over, but to have our staff close to the facility would be great, and to give them an opportunity in something more affordable. So we'll continue to focus on that. Carpooling, New Jersey Transit, I think there's a lot of opportunity there. So I appreciate those points. The one challenge with here, you'd think everyone lives local, and it's amazing when you do the zip code analysis, the distances folks come from to work at the academic medical center. They're all over the state. There's a bunch of them in New York. Those do, for the most part, take mass transit. So again, all good points. You hit many of them.
There was a question here.
Yes.
Hi, my name is Claudia Orlando, soy promotora de salud y mi pregunta es ¿cómo se sienten ustedes con el avance y desarrollo de los programas ya mencionados? ¿Y qué impacto crea en ustedes y en esta comunidad?
Someone able to translate?
Hello, my name is Mary Romero. I'm a community health educator, so I work with community health ambassadors. So the question is, how do you feel about the programs, how do you feel about the progress and development of the programs mentioned by Maria Merced, and how does it impact in your role and work that you do?
So I'll take a stab, and I'm going to ask either Mariam or Chris to help me to translate. Many people who know me know that I'm an enormous fan of Mariam Merced. So generally, when she and I meet, she comes with a list that gets me excited about the work that we're doing in the community. And then she will tell me, and here's what we need from you. We are in the business of saying yes to Mariam because we know that it serves all of us in reality. It's something that we're just so proud of, because every organization has language. Every organization says, here's my mission statement, here's my vision statement. The work that she is leading demonstrates how we actually put that into action. I'll pause there.
El señor Lee es un fanático de nuestro trabajo. Dice que cuando yo llego a la oficina a reunirme con él, le tengo una lista de todo lo que estamos haciendo, y él se pone muy contento, pero él sabe que yo tengo otra lista de todo lo que necesite para hacer el trabajo. Yo creo que para ellos es muy importante este trabajo y esencial, ¿verdad?, para el trabajo que un hospital de este calibre tiene aquí en la comunidad.
Thank you.
Gracias para tu pregunta.
We have to have to jump to the 4 questions that Charlie asked. We have 3 more. Come on, 3 more questions. Anything else? Well, we really appreciate your time, and I know we went over, Charlie, that's why some left before when it hit 7, so I apologize about that. I thank all of you that were able to stay with us. We're excited, obviously you can see the passion in the room and the excitement that we have. And one thing I thought of that I'd just like to end on, and then I'll ask Alan that, is every year when we presented the new staff, we had a bunch of people we were introducing. This is the first year we had 3 physicians. Usually it's administrative folks, so what I think is so important is that we're staying, the team staying and sticking together and working with Rutgers and connecting to all the community leaders throughout New Brunswick and the surrounding areas. That's special because when you have turnover, it's not good for the hospital. It's not good for this market in this city. So I thank you for being here every year. I look forward to doing this next year. And hopefully we only introduce new physicians that are adding to our talent. Alan?
So that's a hard act to follow. I'll be very, very brief. It's really just words of gratitude. It's wonderful to see this gathering. Everybody who's present in this room right now is committed to improving life for those who are in this community. And it's profound. This health system, and certainly Robert Wood Johnson University Hospital here in New Brunswick, are also in alignment with that commitment. We simply ask that you remain committed. We have several folks in the room that are doing a lot of very intentional work in this area that hold us to a high level of commitment, if you will, that will make sure that we are partnering well and living up to our mission. But I think seeing it in action with so many of our community workers as well as those who lead in these spaces that are here tonight is really sort of an indication of what's possible. There's an evolution that's occurred here in New Brunswick and its surrounds. And we have to make sure that we are aware of that. And then there are, as Charlie indicated, there are sometimes threats within our global environment, within our local environment. And we have to be a safe space for all of the people that live here. We have to be a safe space and create hope. That's one of the things that our Jack and Cheryl Morris Cancer Center, you're going to hear a lot more about, is that we have to be a place, a beacon, that creates hope in our healing journey. So thank you all so much for joining us this evening.